Hello, my name is Abigail Williams, and today I'd like to talk to you about the mental and physical health of retired athletes, collegiate and professional. So I want you to picture something for me. It's the NCAA Men's College World Series, Tennessee versus Texas A&M. Xander Seacrest is pitching on the mound for Tennessee with a 1-2 count on batter Ted Burton for Texas A&M. There's 2 outs, no runners on, and all Ted Burton needs to do is hit a home run to tie the game. Here comes the pitch, it's low and outside. Swing and a miss. Tennessee wins the national championship. But what are they left with when the game's over? What was Scotty Scheffler left with when he won the Masters? What was Francis Marion softball left with when they won the conference championship? Might have been a green jacket or a trophy or a ring. But on a deeper level, a lot of athletes will tell you that what they're left with is pain. So today we're going to talk about the mental pain like depression, the physical pain from years of strenuous work, as well as the outcomes that come with all of this pain. So let's go through mental pain first. For a lot of athletes, when they quit their sport, mental pain is the first thing that they notice. And a lot of times, this pain is the one that's overlooked, that's been there the whole time. Athletes are too busy to notice that really it's been a problem and an unhealthy habit forever. Let's talk about Sarah Skurla. She was a retired golfer from the University of Delaware, and she had to retire due to a back injury. She tells us her story, and the first thing she shares is that she falls into a depression where she feels a lack of purpose. And what I want you to notice is that it is possible to retrain your brain, but leading to my next point, you don't even know it's coming, so you don't know what to train for. A lot of athletes don't know that mental battle's coming because they've never lived without sports before. And a study by Endeavor Health tells us that there's an attachment to the game that players don't recognize until they're done. So, yes, you can train your brain, but most athletes are not prepared and they don't even know what those emotions are going to feel like. Now let's talk about the physical pain. Physical pain can grow over time, and you really only notice it after you try to do something and it's not as easy as it used to be. So, most people, non-athletes usually, they experience wear and tear, but athletes experience a wear and tear that happens quicker and affects them and is more damaging. So I want you to notice that there is a study by Paul Sharma and his colleagues, and he tells us that athletes face more pain than the normal person. He also mentions that athletes, based on all their training, learn to cope with that pain, and they can even endure it longer. But he does tell us that implementing training to help cope with that is very important. Now let's talk about the NFL. Professional football is very high in injury rates, and I want you to know that as we talk about this. So there is a study done by the Journal of Clinical Sports Psychology, and they noted that 80% of retired NFL players experienced severe daily pain. And what I want you to know about this is that pain can be tolerable, but it can also stick with you for the rest of your life. So what I want you to know is that mental pain and physical pain, they're both really steep uphill battles. But on the other side of that is the outcome and how you deal with it. So I want to tell you that I'm a current collegiate athlete. I'm a pitcher on the softball team. And I already question my everyday based on my back pain, what I can tolerate that day. Let's talk about somebody who might be higher up than me, say a Division I softball player. She's doing more reps than me at practice and more weight than I am in the weight room. And I want you to imagine her pain. And then I want you to imagine her pain in 10 years. So for an athlete who's already questioning it now, multiply that by 10 for an athlete who's already retired going through that now. Think about a catcher, maybe for softball or baseball, with bad knees after years of playing. They are going to question whether they can even walk their dog at night. Sarah from the University of Delaware is going to question whether she wants a job where she sits at a desk for 8 hours a day. This pain leads to changing your life. It is important in every aspect. Another outcome that we need to talk about, unfortunately, is suicide. And there are a lot of athletes who feel like the pain is so unbearable that they can't experience it anymore. The NCAA did a research and they stated that a lot of the suicidal tendencies from those athletes are because they were taken away from their sport from injury, they were fired, or they retired. When you take away what a player worked to control their entire life, you take away their purpose. So while we feel deeply for all these athletes with mental pain, physical pain, and who make those overwhelming decisions, I want you to know that the real question is what we're going to do about it. What are we going to do? Are we going to train them mentally? Are we going to give them a program where they can feel like they're not alone? Or maybe we're just going to give them more time to be a human rather than a star athlete. I know you think that there's more to life than sports, but imagine somebody who grew up playing the sports their entire life. So I ask you today, reach out to an athlete, retired or not, check on them, talk to them, make sure they're okay. Thank you.